Hello, good afternoon. Today I thought I'd just talk about some of the readings that we've been going over this past week and that focus on cultural humility and intercultural competence. And we'll talk a little bit about sort of the role of differentiation of self in family therapy practice. We're often thinking about how that applies to the patients, the folks that we're working with, but it also applies to us as therapists and as supervisors in the future. So, some of the goals I have for today is to define what cultural humility is and to distinguish it from what historically was the focus of cultural competence. And then I want to explain the differentiation of self and its two dimensions. And then I want to describe how differentiation of self mediates the humility of and the connection between that and intercultural competence. And then I want to talk about applying culturally responsive supervision frameworks to clinical practice. So why cultural humility matters? There's a real big gap that exists between knowing about a culture and being able to navigate that difference. It's not enough just to become an expert and learn some facts and trivia about other cultures. I do want to balance that with I think there is some importance in reading up and studying and trying to learn more about different cultures so that we can ask intelligent questions, but we still want to do that from a tentative place, and we'll talk more about that. So, as I've said in previous lectures, that there's just in our field, there's just movements that happen, and what is sort of in vogue in one decade is probably going to be very different in the next. And I think of them as sort of building on it. And so previously, the focus was on developing cultural competence, which was about acquiring knowledge, mastering skills for diverse groups. It was often treated as sort of an endpoint. We want to become culturally competent. And then there was the risk of overconfidence in cultural knowledge. I know your culture, and that can lead to making assumptions about similarity. I think about that. I have lived in Mexico for 20 years. I have daily, constant interactions with people from Mexico. But I would never say that I am an expert in Latino culture. I have thoughts and ideas and reactions and write about the topic, but I'm always going to recognize that my positionality and that I come from a different location, and that's part of what cultural humility is. It's recognition that this is a lifelong process. We want to get on the path, and we never want to arrive. So it's also an awareness of one's own limitations. It's other-oriented interpersonal stance. It's an openness over certainty, and then it's sort of leading with the idea of, I'm asking for your help in understanding your particular experience. I'm not. You probably all had that experience where someone finds some aspect about who you are, and you feel that lock in place sort of thing happening where they're no longer seeing you, they're seeing a label about you. So it correlates better with better outcomes if you're approaching it from sort of this more tentative stance. So some of the five dimensions of humility, we talk about what is humility in the cultural humility. It's the ability to accurately engage in self-appraisal, recognizing the strength and limitations without defensiveness, and being opening to an ongoing reflection about that. It's other orientation, it's low self-focus, and a genuine interest in the person sitting in front of you. It's interpersonal receptivity and openness to unfamiliar beliefs, values, and worldviews. And then as part of that, we're sometimes that there can be challenges that happen in that process, challenges towards you, and so it's the ability to sort of engage in emotional regulation, managing your pride, your arrogance, your ego, whatever you want to call it. Noticing when a chemical dump happens in your brain and being able to regulate things so that you can remain present and calm. And then it's an appreciation of others, recognizing value in people different from oneself, even when their values might contrast with your own. So differentiation of self. You probably have been reading about that as you study Bowen If you take sex therapy, maybe you come across the concept in Snarch's work, but it's one of Bowen's foundational constructs and why it predicts how we handle differences. So there's two dimensions I mentioned: the interpersonal, first, emotional reactivity, the degree to which emotions overwhelm rational thinking, and the ability to tolerate anxiety in self. It's the I position, the ability to hold a clear sense of self and values without being reactive to the pressures of others. And it's also the second dimension is interpersonal. The tendency to fuse too much with another person is problematic. To lose yourself in relationships, the difficulty in maintaining boundaries while staying connected. And then, there's two sides of that. There's the cutoff, and then the flip side, which is two sides of the same coin, yeah, emotional cutoff. Managing anxiety by distancing or cutting off from relationships. And think about how your level of differentiation as a therapist might play out in your work. Are you able to stay grounded and connected and present with a patient, or do you find yourself being overly connected to them or distancing from them? So there was some research that was done by Paine and his colleagues, where they took 75 MFT counseling and ministry graduate students from a Protestant university, a range of age range of 21 to 63, and they were looking at a person's dispositional humility, like kind of as a trait. They would assess for that, and then they would see if that predicted differentiation of self and if that mediates to more intercultural competence. And some of the key findings is that differentiation, especially fusion with others, was it could be problematic, but it helped mediate humility, and that the intercultural competence in the relationship. So humility alone didn't predict whether that competency was there. There had to be other factors involved in that. So let's slow it down and think about this. So what does this mean for our practice? So the authors of that article suggested that effective navigating differences means not losing oneself in the relationship or in the other person, and maintaining a sense of self separate while negotiating cultural differences between self and other. So in your own work, in your future work, think about clinical moments or populations where you might be feel pulled towards a client's cultural worldview. And then what happens in those instances to your own sense of self? And how does your own differentiation level show up when working with families whose values strongly differ from your own? Um, I've shared with you my Tracy Lazofsky and my article on political differences. So, since that's a very present thing that's going on, think about that. How are you able to engage with someone who might share your political views versus someone who doesn't share them? And if that person was a patient, um, uh, how might you be pulled into either enmeshment or cutoff? And then what is the difference between empathy and fusion in cross-cultural cultural work? Think about any group that you want in regards to that. So part of another one of our readings was about what does this look like in supervision? And although most of you are just sort of starting down the path of becoming therapists, many of you will go on to take on the identity of a supervisor. And even if you don't do that, you're going to be involved in supervision relationships. So I still think that this is relevant for where you are in the stage. So thinking about the cultural humility model, the synergistic model, and the feminist multicultural model. I know you've read all this. I won't go over each of these, but these are three frameworks that I think are worth knowing. And there are also ways that these concepts that apply in supervision also can apply in your clinical work. I thought this was maybe more important or more relevant to you all, sort of the six domains of cultural competence supervision, and then just think about how this is also applicable for you in your clinical work. Awareness of your own values, biases, and worldviews, and facilitating supervisee or clients' awareness of their values and beliefs. Supporting multicultural client case conceptualization, like how do we conceptualize what we do and what we don't do with this supervisee or client, based on sort of their positionality in the world, and then guiding them towards culturally appropriate intervention strategies, attending to the multicultural process within the supervision itself, and then sort of evaluating the supervisee's multicultural competencies fairly. The problem is always like, how do we become conscious of the things that we're not conscious of? And that is why it's a lifelong work, because there's always blind spots that can happen. All supervisors must be culturally competent in, or their trainees may continue a cycle of misusing power and privilege that could occur in the therapeutic process. And then you, in the position of a therapist, be thinking about that. Like, what are the ways that I might have blind spots, the ways my power and my privilege are playing out? Some of the risk factors in this regard: unexamined biases about other cultural groups, assuming diversity training is sufficient, avoiding race, identity conversations, or other hot topics. Again, I've shared that I think we don't talk about politics, and then how politics show up in the therapy room, and then hierarchical or non-reflective stances. And some of the protected practices that you are already starting to engage in is maybe you do a cultural genogram construction and share that with others and have dialogues about that. The supervisor also hopefully is engaging in self-disclosure about their own missteps, humanizing that we all make mistakes, and it's more about, do we make repairs? Regular reflexive questioning about power dynamics, and in supervision, and then supervisors receiving their own supervision. So we never stop needing to get outside of our own thinking and our own minds. And so whatever phase you are in your professional life, it's useful to be talking to others and to get outside feedback. So in the article, it shared a case vignette about the Vegas family. In short, just a reminder, it was a single Chilean father, a surgeon, Catholic, two daughters, and they were living in the United States. I'm hoping my Zoom is editing out the helicopter that appears to be landing outside my window. But in the case, they were presenting with the older daughter's suicidal ideation. The therapist was a 27-year-old Euro-American female doctoral student, lived in Costa Rica, and had a strong interest in Latino culture, a positive affiliation or a positive view of Latin culture. And then the supervisor was a 43-year-old Latinx female, working class background, currently a PhD, and also who identified as bicultural. So some of the things to think about in this case are, what are the power dynamics across the supervisor, supervisee, and client triad? And then considering intersecting variables like gender, class, ethnicity, and generation. And then just my critique, always, we should talk about nationality, because you're working cross nationality in this case, and nationality remains invisible. So pet peeve of mine. So how might the therapist's affinity for Latino culture become a blind spot rather than a strength? Sometimes we think, oh, I like this community, population, whatever, and we don't see, like, well, that good or bad? And it's probably both. So let's try to look at the positives and the shadow side. And then how do both humility and differentiation apply to how the supervisor should work with the supervisee in that case? So I'm not going to go into each of these, but think about in the therapy room, in supervision, and then really we want to be on the path. So for your own development. When I first was reading the topic, I thought about an article I read a long time ago about empathy. And the question was, can empathy be learned? Because empathy or humility, in some ways, those might be sort of people are born with differences around that and the capacity for it. So what if it's less? This article and others I've read have said, even though it might not be as natural for one person versus another, these skills, it can be improved through reflection and through these are trainable skills, and that there are skills that we can train ourselves and that we can engage in training with others. We need to seek out immersive cross-cultural experiences. We need to engage in our own personal therapy, work on our own differentiation, and then again, just remembering that cultural sensitivity is lifelong, and it's an affective process. So just a closing thought, the capacity to balance particularity with universality, to stay engaged in the ongoing dialectic process of relating to the other in her or his differentiation and similarity is at the heart of intercultural competence. So yeah, takeaway questions for you to journal about, think about, talk about with other colleagues. How differentiated am I when my values clash with the client's? Do I approach supervision with a curiosity about my own blind spots? And am I practicing cultural humility, or is it just cultural familiarity? And then what questions would you have put there? Okay, thank you all.